Hello, this is Dr. Pavan Murdeshwar. I am a cosmetic and a plastic surgeon. I do practice in Jayanagar 9th block at my clinic, Helios Wound and Plastic Surgery Clinic. Vaginal tightening is a simple procedure which you will undergo, and post-vaginal tightening you will be sent home by the doctor. But there are few things which the doctor will guide you. For example, there are few of the do's what we suggest is to keep on cleaning the area by using a dilute chlorhexidine wash regularly until at least 2 weeks what we say. Second thing is use of a laxatives that will definitely help in releasing the pressure over the sutured area. And the next thing would be few doctors might advise using the estrogen creams over that area that will help in preventing the atrophy of the mucosa and help in healing. And lastly, if at all there is any spotting, there is any mild fever, do consult your doctors immediately. Coming to the don'ts, so definitely these are the things which will be more stressed by the doctor to you. One thing is avoid the strenuous activity for the next 2 weeks. So like squatting or any regular jogging what you are going for, or the heavy exercises to be avoided. Next is the sexual intercourse or the consummation has to be avoided for the next 6 weeks to 2 months. The patients have to avoid fingering in the area or touching the sutures by any kind, and even using any kind of tampons or douches in this area. So that will definitely help in healing the vaginal tightening very well. So to watch more of my videos, do subscribe to Dr. Circle.